Welcome, medical students. Today, we're diving deep into the fascinating world of neck triangles. The neck is a complex region, packed with vital structures in a relatively small space. Understanding its anatomy is key to successful surgeries, accurate diagnoses, and effective treatments. Neck triangles are anatomical regions defined by muscles and other structures. They serve as important landmarks for identifying and accessing various structures in the neck. From locating pulse points to performing surgical procedures, mastering neck triangles will make you a more competent and confident medical professional. In this guide, narrated by Dr. Veera Rohith Yeriboina, we'll explore the two main neck triangles, the anterior and posterior triangles. Let's begin our exploration of neck triangles, your gateway to understanding this critical region of the human body. The anterior triangle of the neck is a crucial anatomical region that every medical student must understand thoroughly. This triangle is formed by three key boundaries: the anterior border of the sternocleidomastoid muscle laterally, the anterior midline of the neck medially, and the lower border of the mandible superiorly. Within the anterior triangle, we find several smaller triangles, each with its own significance. These include the submental, submandibular, carotid, and muscular triangles. The submental triangle, located beneath the chin, is bounded by the anterior belly of the digastric muscle on each side and the hyoid bone inferiorly. The submandibular triangle, as the name suggests, is found below the mandible and contains the submandibular gland. The carotid triangle is where you can palpate the carotid pulse, and where many important structures, including the carotid artery and internal jugular vein, are found. Understanding these subdivisions is crucial for precise anatomical knowledge and clinical applications. Now, let's turn our attention to the posterior triangle of the neck. This triangle is larger than the anterior triangle and has a different set of boundaries. The posterior triangle is bounded by the posterior border of the sternocleidomastoid muscle anteriorly, the anterior border of the trapezius muscle posteriorly, and the middle third of the clavicle inferiorly. The posterior triangle is further divided into two smaller triangles, the occipital triangle and the subclavian triangle. The occipital triangle contains the spinal accessory nerve, which innervates the trapezius and sternocleidomastoid muscles. The subclavian triangle contains the subclavian artery and the brachial plexus, making it an important area for vascular and neurological examinations. The floor of this triangle is formed by several muscles, including the splenius capitis, levator scapulae, and the scalene muscles. Mastering the anatomy of the posterior triangle is essential for procedures such as central venous catheter placement and brachial plexus blocks. The blood supply of the anterior triangle is rich and complex, playing a crucial role in nourishing the various structures within this region. The primary arterial supply comes from branches of the external carotid artery. The superior thyroid artery, the first branch of the external carotid artery, is a key player in the blood supply of the anterior triangle. It descends along the lateral border of the thyrohyoid muscle to reach the superior pole of the thyroid gland. Another important artery in this region is the lingual artery, which arises from the external carotid artery and supplies the tongue and floor of the mouth. The facial artery, also a branch of the external carotid, enters the submandibular triangle and supplies various structures in the face and neck. The venous drainage of the anterior triangle is primarily via the internal jugular vein and its tributaries. Understanding this venous system is crucial for procedures such as central venous catheter placement and for managing conditions like deep vein thrombosis in the neck region. The blood supply of the posterior triangle, while less complex than that of the anterior triangle, is equally important to understand. The primary arterial supply in this region comes from branches of the subclavian artery. The transverse cervical artery, a branch of the thyrocervical trunk, is a key vessel in the posterior triangle. It crosses the posterior triangle superficially, running parallel to the clavicle. Another significant artery in this region is the suprascapular artery, also arising from the thyrocervical trunk. The occipital artery, although primarily supplying the posterior scalp, also sends branches to the upper part of the posterior triangle. The venous drainage of the posterior triangle is primarily through the external jugular vein. Understanding this venous anatomy is crucial for procedures such as external jugular vein catheterization and for managing venous pathologies in the neck region. The nerve supply of the anterior triangle is complex and diverse, reflecting the variety of structures found in this region. One of the most important nerves in the anterior triangle is the vagus nerve, cranial nerve 10. It descends within the carotid sheath, alongside the internal jugular vein and common carotid artery. The hypoglossal nerve, cranial nerve 12, is another significant nerve in this region. It curves around the occipital artery and passes deep to the posterior belly of the digastric muscle to enter the submandibular triangle. The cervical plexus, formed by the ventral rami of the first 4 cervical nerves, C1 to C4, provides both sensory and motor innervation to various structures in the anterior triangle. The ansa cervicalis, a loop formed by the union of superior and inferior roots from the cervical plexus, innervates the infrahyoid muscles. Sensory branches of the cervical plexus, such as the transverse cervical nerve and supraclavicular nerves, provide cutaneous innervation to the skin of the anterior neck region. The nerve supply of the posterior triangle, while less complex than that of the anterior triangle, is equally important for medical students to understand. One of the most important nerves in the posterior triangle is the spinal accessory nerve, also known as cranial nerve 11. This nerve enters the posterior triangle by piercing the sternocleidomastoid muscle. The spinal accessory nerve provides motor innervation to both the sternocleidomastoid and trapezius muscles. The cervical plexus, formed by the ventral rami of the first 4 cervical nerves, or C1 to C4, also contributes significantly to the innervation of the posterior triangle. Several cutaneous branches of the cervical plexus emerge at the posterior border of the sternocleidomastoid muscle, providing sensory innervation to the skin of the posterior triangle. The brachial plexus, while not entirely contained within the posterior triangle, has its roots and trunks passing through the lower part of this region. Understanding the course of the brachial plexus through this region is crucial for procedures such as interscalene blocks and for diagnosing conditions like thoracic outlet syndrome. The clinical significance of neck triangles cannot be overstated. In the anterior triangle, the carotid triangle is of particular clinical importance. This is where the carotid pulse can be easily palpated, making it a key site for assessing circulation. The anterior triangle is also crucial in thyroid surgeries, as the thyroid gland and its surrounding structures are accessed through this region. The posterior triangle, while less frequently the site of surgical interventions, is no less important clinically. The accessory nerve, which traverses this triangle, is at risk during lymph node biopsies or neck dissections. The subclavian triangle, part of the posterior triangle, is an important site for accessing the subclavian vein for central line placement. Both triangles are important in trauma scenarios, guiding management decisions based on the zone of injury. As we near the end of our comprehensive exploration of neck triangles, let's recap some key points that every medical student should remember. The neck is divided into anterior and posterior triangles by the sternocleidomastoid muscle. The anterior triangle is further subdivided into smaller triangles: submental, submandibular, carotid, and muscular, each with its own contents and clinical significance. The posterior triangle is divided into occipital and subclavian triangles. In the anterior triangle, the carotid artery, internal jugular vein, and vagus nerve run together in the carotid sheath. In the posterior triangle, the spinal accessory nerve and branches of the cervical plexus are key nervous structures, while the transverse cervical and suprascapular arteries provide the main blood supply. The anterior triangle is crucial for procedures involving the thyroid, larynx, and major vessels. The posterior triangle is important for accessing the brachial plexus and subclavian vessels. As we conclude this comprehensive exploration of neck triangles, I hope you've gained a deeper appreciation for the complexity and importance of this anatomical region. The neck, despite its relatively small size, is packed with structures that are vital for numerous physiological functions. Understanding this intricate anatomy is essential for any aspiring medical professional. So take the time to study and visualize these neck triangles thoroughly. Thank you for joining me on this journey through the anatomy of neck triangles. Until next time, keep exploring and expanding your medical knowledge.